event that's happening, and that involves the Health Minister there, whom you can see live on your screens, Dr. Joe Phaahla, who met with the MECs from each of the 9 provinces today to review the nation's health as part of the National Health Council. Let's take a listen.
From our biggest province in terms of geographical length, our MEC from Northern Cape, MEC Lekwene. Now, just to give you a sense, we started with a discussion on, for the first time, we said let's give ourselves time also to just get feedback from our provinces in terms of some of the challenges, some of the work they are doing, but also reviewed on some of the work which we have been doing collectively. Just in terms of some of the issues which you have communicated to yourself previously, before I come to just the summary of the reports from all our colleagues, you would remember that starting from early in the year, and then in March we had a much bigger outbreak in the Tshwane district, in the Tshwane Metro, largely in Hammanskraal and surrounding areas, some of the areas of the northwest, and a little bit of Mpumalanga, and also a bit of an outbreak in Limpopo as well, but also quite a significant outbreak in the Free State province, in the Fezile Dabi district. I think it was Mwate, MEC if I'm correct, Mwate municipality. The good news which you can report is that, notwithstanding the fact that there was a report recently of an additional death, we'll talk to that, essentially we can say that for more than 3 months now, we have not had a case of cholera again. The recent report of a cholera case we have established was actually not a new case. That's why when you look at it since a few days ago when there was a report about the cholera case, you have not had any other situation where there's a contact also in the family or in the neighborhood. This is because the person who unfortunately demised a few days ago was actually wrongly classified as a death from cholera, because cholera is an acute illness which deals with you, and if it's going to be fatal, you know, it's got a particular clinical progression towards complications, including renal failure, and you know. But in this case, as we got deeper into what really happened, as also was reported in some of the media, the old lady got cholera in May. Was admitted at Jubilee Hospital, got treated, got released, went home. Now, the concern of the family was that after coming out of hospital, she was never really as active as before. But what we have gathered is that she also had other comorbidities. But in terms of an active test of a new test of cholera, this was not the case. So, and therefore, it is not surprising that since then, despite the tracing in the families and so on, we have not had any further outbreak in this regard. Also, the other, in terms of infectious disease, measles outbreak, which had started late last year, we reported on that. There was a major campaign in terms of immunization of children in all provinces, working with our colleagues in the basic education sector. In that regard as well, we are pleased to announce that we haven't had a recurrence of the measles outbreak at this stage, so the situation is fairly stable in that regard. Of course, we continue to deal with our other infectious diseases, which are a major burden in this country, which is HIV and AIDS, and also TB. So we also had time to reflect on our performance in that regard. We are part and parcel of the United Nations and WHO countries which have committed to making sure that, one, we should make sure that TB is eradicated by 2030, also in line with our own national development plan, but also making sure that HIV and AIDS basically no more become a serious health threat, an international and national health threat. And that's why we are part and parcel initially of the 1990, which says 90% of the people knowing their status, 90% on treatment, and 90% virally suppressed. We have made strides, especially in terms of people knowing their status at 95%. We are currently on the target of 95% by 2025. So we are pushing in that direction. We are still have a lot to catch up in as far as the 95% of those who know their status being on treatment. We're still sitting at a figure of 78% of those on treatment. Of course, then it affects the last 90. It looks good because we are at 90 in terms of viral suppression, but it's the 90% of 78, which therefore means that we still have a lot. There's an improvement because compared to when we last met, where we had to catch up with about 1.2 million people to be put on treatment, there's been some improvement. An additional 200,000 more people have been put on treatment, but we've got a lot of work to do to make sure that we can reach the 95%, which means we need to trace another plus minus 1 million people who are HIV positive, because the good thing about where we are now with the progress in the science of treatment is that the treatment regimens which we have now guarantees that if you remain sustained on treatment, you can have viral suppression, and if you have viral suppression, it means you are not transmitting the virus. So those are the things which we're going to be pushing in the remaining part of this financial year, working with all our partners. And we also thank all our especially our funding partners, the Global Fund, which also continue to support us, and also PEPFAR, the American Presidential Program, which is giving us quite significant resources. In terms of other services, colleagues gave us reports which show that there is continuous efforts to improve the quality of services. From a primary health level, almost all provinces are showing improvement in as far as the target of achieving the ideal clinic. Ideal clinic meaning that the clinics which are able to meet what you call a platinum status in all respects, in terms of the facility, in terms of the services, in terms of the staffing, in terms of the attitude of staff, and all those issues. So most provinces, as they report, they're in the region of 80% of success in as far as meeting the standards of ideal clinic. So that's a good progress in that regard. Of course, in as far as hospital services, almost all the provinces also indicate various efforts to improve the infrastructure, to improve the equipment, to improve in terms of staffing, and also just overall improvement of the experience of care by the users of our services. But all the provinces indicate a lot of pressure. One of the provinces indicated that on average their hospitals are sitting at 90%. And that was, I think, maybe I just forgot to mention that we didn't have the MEC for Western Cape, but the HOD was here and he provided us a report, and he was the one who indicated that in this province they are sitting at 90% of occupancy of most of the hospitals, and over and above the normal burden of disease which we are having. And it's not the Western Cape alone. They indicated that trauma and injuries are a major issue in terms of the burden, and especially on weekends, that when it comes to weekends. So that's the thing which, as a health sector, we want to appeal to South Africans to say, the whole habit that come a weekend, the drinking spree, and then there's going to be fights and shootings and stabbings. It's not only something which is not good for our health services, overburdens. It makes you even start to long for the wrong things, which is the lockdowns. You will remember that when we had lockdowns, you would find situations when the liquor is closed and casualty departments will be empty, even on New Year's Eve and so on. So those are the challenges which all the colleagues here are indicating that we're facing. Of course, there is pressure in terms of all of us are facing the pressure in terms of continue to improve the services, the infrastructure. We're working together in terms of support from the national on infrastructure grants, and all the colleagues are using those and also their own resources to improve the infrastructure. High pressure on human resources, especially, I mean, both urban and rural. Of course, our rural provinces like Limpopo, Eastern Cape, in some of the services, like we're getting report about the mental health services. At the national department, we provide support because mental health is growing. All the provinces are showing very serious pressure of mental health service demand, and many of those are young people. And I think that's another appeal which we can't win that battle alone as health. We work together with our social development, but we need communities, because a major part of that pressure on mental health is substance abuse. Nyaupe, all sorts of drugs. If you go to everybody here is reporting that their casualty departments, instead of attending to pregnant women, taking them to maternity, you have a lot of young people under the pressure of substance abuse. So through yourselves as the media, we also wish to ask you to help us in spreading the message. So I must say that very encouraging in terms of those reports. Colleagues are making a lot of efforts to improve the services, notwithstanding the challenges. Let me go then immediately to a major challenge which then complicates what I've already mentioned in terms of the efforts which all the colleagues are making. I'm sure we are all aware of the pressure which government is under in terms of the financial situation. Treasury has been communicating. There are a number of things which were communicated in a particular way. Cabinet has reviewed to say we need to manage these issues in a different way. But the fact of the matter is that the advice and request from Treasury that there is a serious pressure on the fiscals, and we need to do everything to contain costs. That also applies to all of us here. We have discussed that. Serious implications, amongst others, we have already reported to the team here that based on a discussion between our DG, our Chief Financial Officer and the management team, there has been discussions, and we have made our own contribution to the reduction of government spending. And this has resulted in our contribution of just over 1.6 billion, which we have confirmed through the discussions that this is a contribution. It comes at a cost. Some of it, this is coming mainly from the national budget. I'll comment about what is the impact on provincial budgets. So, but although it's a national budget, some of it, only 200 million is directly in terms of the personnel and other cost savings at the national department. Others of the 1.6, 400 million plus minus 400. Although it's a budget which is managed by us nationally, but it's what we share with provinces for infrastructure. So there's going to be a reduction in as far as that very matter which I mentioned earlier, that all the colleagues have to deal with improving the infrastructure. So there will be some reduction in what is available, and therefore the speed of dealing with some of the infrastructure matters will be slower, because there's going to be across the board, we've tried to manage to make sure that none of the provinces carry all the burden in terms of this 400 million, which was to go to all provinces. And then, of course, I've mentioned already about progress we're making on HIV and AIDS, TB, but we have to make a contribution, again, in that area of the grant which we manage nationally to manage TB, HIV and AIDS. We will be contributing just around R1 billion from that allocation. Again, This is what we share with provinces. So it's divided. Not one province will contribute this in terms of what we're going to allocate to them. We just distributed it. But we also, is again, I must emphasize, is a result of discussions with Treasury. We also had to look at the spending patterns, because we've been able to negotiate reduced prices in as far as antiretroviral treatment with the various suppliers. So it sort of helps us. But I must say also we're going to mitigate against this through, I've mentioned, our partners, such as the Global Fund and also PEPFAR. They are continuing to support us in this regard. That's going to mitigate against the impact on the HIV and AIDS. We've already have some commitments from some of those partners that they will step in if the pressure becomes high as a result of our contribution to the Fiscals. So that's really where we are. In terms of the impact on the provincial allocations, equitable share. So where the provinces will be hit will be on the conditional grants, the infrastructure grant and also the HIV grant, but there will not be any impact on the equitable share. Of course, the Minister of Finance will confirm that, but we have been given that promise that there will not be a similar demand for provinces to share, to contribute, from their equitable share, the money which already is in their budgets. So we are also, of course, discussing with Treasury. I leave to my colleague, Minister Godongwane, when the matter is finalized. We're discussing to look at ways in which they are looking at to help us, especially with our human resources cost of employment, with the salary increases, to see how much they can assist us. There's promise that something is going to be coming. We don't know how much, but in principle, there is agreement with our colleagues in finance, with the support of cabinet, that there will be some assistance, so that we don't lay off doctors, we don't lay off nurses, frontline services across the board, because that will be quite a disaster. So there is a promise. The Minister of Finance will make the announcement when it is final, when that is concluded. So because of as part of and parcel of the entire state, we do welcome that there is that promise, and we hope that it will materialize, and when the Minister makes announcements, possibly at the medium-term budget policy statement, that might be probably where such announcements may be made. But we're looking forward to hopefully that. Still on the matters of finance, just to say, we also just deliberated briefly on our own performance in as far as looking after the resources of the country in our area of health, and we are pleased to can say that we are now at the end of, we have finished the audits, we have submitted our annual reports, one or here and there where there's still some few things remaining, but I can say to you that overall, from accountability, there is serious improvement in the health sector. Most of our provinces have received either a clean audit without qualification or unqualified audit reports. A lot more improvement. So we are moving in the right direction in that regard. Provinces which I will not go name by name, one of our provinces here which had qualified audits for 10 years has now joined the stable of the unqualified. So welcome. And I can say also that from the National Department, we had some challenges with the vaccination program where there were some qualifications. That also is behind us, and most of the provinces are also on board. But also all the entities which report to this sector, whether it be the organization which in its promises we are, the Medical Schemes Council, the South African Medical Research Council, the National Health Laboratory Service, SAPRA, and all of them have received unqualified or clean audits. The Office of Health Standard, all of them can account, and they've satisfied the Auditor General that they are definitely in good standing. Some of the quickly just other issues which we dealt with We've approved also the introduction of expanded program of immunization for children. There are some changes in as far as immunization. We are spending all in all per annum just over 3.5 billion rand on vaccination program for children. So there's improved vaccinations which we are going to be delivering to prevent whooping cough, tetanus, diphtheria. There are new vaccines which we are introducing. These new derivatives will reduce the chances of the resurfacing of some of these conditions in the community. Also, we are also introducing a combination vaccine of measles and rubella. Rubella had not been routine vaccination in our facilities. Now, the rubella vaccine is very important because this is a vaccine which prevents malformations. In other words, where babies are born with some deformities. Some of them can even be internal organs in the heart, limbs, and so on. So this rubella virus, if it's not prevented, it can cause this. We are now going to be, it has not been routine in children. We are now introducing the rubella vaccine. The pneumococcal vaccine is continuing. We're going to be rolling out continuation of, it has worked very well together with the rotavirus. So it's full steam in us, and this has been recommended by our ministerial committee on the National Advisory Group on Immunization. So all these changes will be happening from January next year. In as far as the COVID vaccination, of course, as you all know, we're still carrying a number of vaccines, but the uptake is no more there. There's no appetite. We've been confirming that there's very low, if any. The COVID virus is still in our midst. In fact, one or few of within even our teams here, some of the colleagues, they get the flu, and then when they test, it's COVID. But it's because everybody here is vaccinated. Even when we do get that, it's very mild, and everybody in society who has been vaccinated, of course, also with the herd immunity, the community immunity, it's also helping. But we again want to urge people that we still have vaccinations. We still have Pfizer. We still have. So for those who are vulnerable with immune deficiency and others, please come forward. The vaccination is still available. We are integrating. We've already integrated the program with the normal primary healthcare vaccination programs. So that will be continuing. Just to acknowledge also that because of that, what it means, the implications, we're sitting with millions of doses. Some of those are expiring by the end of this year, all our J&J. So anybody who needs a booster of J&J, that's the time to come, because in another month it will be gone. That which we have now will be expired. That's what SAPRA has confirmed. So we'll be getting rid of, I think, can't remember, Professor Nicholas Crisp will tell us, I think about 9 million doses or so, somewhere in that region. And then the Johnson & Johnson remains available also, but it's also injury time. Come end of February next year, also the Johnson & Johnson, we can't keep big stocks because it's also expensive for us with all this cost reduction. If we keep on retaining huge stocks in our storage, it's very expensive because we must pay for that. So we just want to assure people that those who want to come forward can come forward and receive. In terms of going forward with the vaccination program, we will going forward because COVID will not be over. So our team is working on acquiring smaller doses. As these ones expire, we will acquire small doses to keep for those who need further boosting, those who are immune suppressed, who need further protection. So we're not going to close the door. We'll acquire small doses to keep as part of our routine services. But also what we are discussing with SAPRA is to make sure that the limitation which had been there with the licensing, that only the state is licensed by SAPRA, we are asking SAPRA also to lift that so that your private providers, those who want to get registered, because it wasn't really that we prevented, but it was the conditions for registration with SAPRA, that will be lifted. if supply is amenable to that, we have discussed that, so that even private pharmacies who want to keep small stocks of their own, not depending on government to provide those stocks, they will be able to provide those. The next issue, which briefly we touched on, expansion of the services which we have already had, working with colleagues with Minister Motsoaledi's department. We expanding services for online birth registration, where we are currently only 161 facilities are able to give these registrations, but we are now adding across the whole country 91 more facilities which will be able to provide online birth registration. So what it means is that there will be very little excuse to say why a baby is not registered for a birth certificate, what is called abridged, when you go later. So there will be no reason for abridged. So we're going to be working with Home Affairs to expand, but we are looking at our facilities which have quite a number of big delivery of services in as far as maternity services. Those will be covered to make sure on the site there's on-site registration and online registration. The last matter which I just want to touch on is that we have been inundated also with public inquiries on the level of risk in as far as the avian flu, the bird flu, in as far as to whether there is a risk on humans since the outbreak of this disease. Our specialists at NICD have been doing some work in terms of this. Now, what they have reported to us is that persons with known or suspected close contact with dead or sick birds from avian flu and who present with upper or lower respiratory tract symptoms or conjunctivitis, that's the infection of the eyes, should seek medical attention. All individuals exposed to avian flu should be monitored for 14 days for respiratory symptoms and be encouraged to seek care as soon as possible once they experience certain symptoms. Again, they emphasize that hand washing with the soap, that is the disinfectant soap, after contact with poultry or birds is essential. So the basic hand washing, hand hygiene, which we introduced, remains very, very relevant in that regard. Clinicians who suspect avian flu infection in their patients should contact the National Institute of Communicable Disease to get guidance in as far as this matter is concerned. Very, very lastly, we've also been dealing with the issue of nurses' uniform. We have an agreement with the unions in the bargaining council to move from uniform allowance, as many of you would know, to providing uniforms from the government. Because of logistical issues, this was supposed to start next year, but we have agreed with all the role players that it will be postponed to next year, September next year, where they will start to provide a uniform, stop the allowance, and produce the uniforms and make sure that they are distributed across. I know that there are some issues in as far as the policy, in as far as certain things which can be worn by the staff as they go into hospitals. I just want to say that these are measures which are taken in terms of infection control, making sure that there is no risk to patients. It's not meant to interfere with any cultural beliefs or any religious beliefs. It's mainly just to make sure that there is a proper control in our health facilities. That is it, colleagues. Those are just the highlights of some of the matters which, as a team here, we have been discussing. Thank you very much.
Thank you, Minister. Colleagues, I think what we would right away do is to entertain the questions. The panel as it is available for any questions that you have. The rules of engagement is that at least as you want to pose the question, just indicate your name and the media house where you come from, so that there is a cordial interaction between yourselves and the panel. what I'm going to do, I'm going to take the first 5 questions, then we'll follow up with the next 5, and then from there we'll make a determination of whether we need to proceed or attend the media briefing. Can I take hands? Logo. Okay, that will.
All right, thank you.
So can we agree that my part is done? Any question will go to.
It would have been helpful if you had a roving mic, because I know we are live on ENCA.
The mic is there. Bring the mic to Boloko.
No, thank you.
It's not.
Thank you. I'm sorry, I'm not too sure if this is.
It's not.
It's fine. No, thanks very much.
Can we have this? Just switch on the mic here. It may help.
This one.
Yeah.
Okay, let's try.
Thank you. Thank you very much. My name is Molu Gomloto from ENCA. I don't know, because you said you can only take 5 questions this time. I have 5 questions alone. So, but I will be very quick. Minister, I got a little bit confused there. But before I even ask this one, just clarify on the money that you will be cutting from the HIV programs. Did I understand you correctly that you were saying you're going to cut 1 billion rand specifically from the overall HIV programs? You can just clarify that. But also, you were talking about percentages. I would really appreciate if you can have or give us the actual numbers. How many people in South Africa are on the HIV program, or sorry, ARV programs? I heard you saying that you are chasing 1 million. Does it mean these are the people who are suspected to be living with the virus and they are not on the ARVs? And then, in terms of the 400 million rand that you are cutting from infrastructure, specify specifically to do what? What was this money meant to do when you talk of infrastructure? And in terms of the avian flu, the concern among some people is that should they eat these eggs? Should they eat this poultry? What is your advice as people in the health authorities? And maybe let me cut my questions short and say, in terms of you were lamenting the fact that most of the cases relates to injuries and trauma. I know in the Limpopo province there's what has been dubbed the Limpopo Midnight Law, where they are prohibiting taverns from selling alcohol, I think, beyond midnight. Has it helped in your province, MEC, or it did not? And would it be advisable to replicate that across the province? Lastly, in terms of the vaccines that you are going to destroy, how much have you paid for those, Minister?
Good afternoon.
Your mics are a problem. You can use Foster. Can use that one.
Zeneko Mhlaba from Newsroom Africa. Just on the avian flu, what is the exact risk to humans? I know you touched on a bit. You also spoke about some of the advices that are coming from the NICD. But in terms of the actual risk to humans, how great is it? Are there any steps the Department of Health is already putting in place to ensure that should it get to us as humans, we can be able to handle it? The second question is for the Gauteng MEC of Health. We've got 2 hospitals that are owing City Power electricity, and today they were served with notices, and that's Rahima Musa Hospital and Helen Joseph. What's being done to ensure that those hospitals are able to pay up their bills? so that City Power does not end up cutting electricity to those facilities. To the Eastern Cape MEC, there are reports coming out of Engcobo in the Eastern Cape under the Chrysalis district about people who are having to take water bottles to the All Saints Hospital because the hospital does not have enough water. Are you aware what's being done to address that challenge? Thank you.
Thank you very much. My name is Nozi Mia from SABC TV News. First, let me start with the MEC of Gauteng. The Minister touched on the issue of how services being provided to people who come and use the public healthcare facilities will be improved, but we know that the number of complaints that are coming out of public healthcare facilities in Gauteng keep going higher and higher. What is Gauteng going to do in terms of improving that? And for the Minister, we know that the census statistics just came out yesterday, and the aim of the census obviously is to assist with planning. How are the recent figures going to assist the Department of Health with planning in light of all these issues that you've highlighted today? And a throwaway question, I see most of the provinces here represented, but I don't see the Western Cape.
I did explain. No, I did explain that the MEC was not able to attend, but the HOD was here.
And has left.
Yeah.
So is unavailable to take questions. Thank you.
Okay, the question and answer session there with the media, the health officials, including the Minister, Dr. Joe Phaahla, Dr. Sibongiseni Dlomo sitting next to him. That's the Deputy Health Minister, and of course, briefing about the outcomes of the NEC meetings, of the National Health Council meeting. Avian flu is featuring very centrally in some of the questions there. But